Don't forget to subscribe. Tap the bell icon to ensure you never miss any updates from Baby Care Solutions.
Best and worst sleeping positions during pregnancy. Best sleeping positions. 1. Sleep on your side. Most experts agree that once the abdomen starts to expand, it is best to sleep on the left side with knees bent. Not only is side sleeping more comfortable, it also helps improve blood flow for the pregnant person and the fetus. 2. Lying on back in half-sitting position. This can assist in averting heartburn. Place some soft, fluffy pillows behind you for added support. Worst sleeping positions. Sleeping on your back. Sleeping on your back can lead to a range of issues, including backaches, respiratory difficulties, digestive problems, hemorrhoids, low blood pressure, and reduced blood circulation to both your heart and your baby. Sleeping on your stomach. When you are farther along in your pregnancy, your breasts become more tender, and your abdomen continues to grow, both making sleeping on your tummy uncomfortable. Tips to be comfortable while sleeping. 1. If you find that you are having problems with back pain, use the sleep on side position and try placing a pillow under your abdomen as well. 2. If you are experiencing heartburn during the night, you may want to try propping your upper body with pillows. 3. In late pregnancy, you may experience shortness of breath. Try lying on your side or propped up with pillows.